Hey guys, it's Teresa here. Welcome back to my channel. Don't know why my voice just did that, but whatever. So today we're going to talk about different practices and what you need to be a veterinary assistant and important terms you really want to know once you start. So, number one, or what your roles can be. So, different kind of practices. There is small animal, which is also considered a companion animal practice, which mostly sees cats and dogs. Sometimes can see the occasional pocket pet, which is hamsters, gerbils, rabbits, just the basics. Well, now then we go to a mixed animal practice, which consists of small animals and large animals, which is also cats, dogs, horses, pigs, sheep, donkeys, not just sheep. What's the other one? I already said cows. So let's just leave it at that. It's mostly farm animals and companion animals and the occasional gerbil, rabbit, hamster, chinchilla, all those kind of small little pocket pets. Another practice would be, there's two more, would be a large animal practice. So that only consists of horses, pigs, sheep, cow, donkeys, llamas, alpacas, you name it. And like farm animal, that's what you get to see. So as a large animal practitioner, you mostly do house calls because it is very, very hard to bring a horse to a veterinary hospital. Because then you have to get in the horse trailer. Then you have to bring it over there. Then the vet has to usually come outside. Sometimes, very rarely, they will have an exam room for just horses, and that is very hard to set up, because it consists of just very many different instruments, because horses need a lot of veterinary care. So you usually have an assistant, and you have the veterinarian, usually a technician too, to set up everything in the room and just get ready for the horse to come. So, but mostly they do house calls, they do farm calls, and those consist of calving calls, dentals, horse dentals, pregnancy checks, a bunch of different variety of things, dehorning. There's just a bunch of different things. So one example of a large animal practitioner or mixed animal practitioner would be Dr. Pohl, and he is located in Michigan. And you may know him from the show, The Famous Dr. Pohl. So he would be considered an example of a mixed animal practitioner. And then the last one I want to talk about is an exotic veterinary hospital. So those see usually snakes, birds, all the small pocket pets I listed, which were chinchilla, hamster, mouse, forgot about mouse, hedgehog, bunnies, lizards, geckos, frogs, turtles. So all those kind of exotic animals, usually an exotic animal practices. You can also think of exotic animal medicine as like what you see in a zoo. Those are only usually at zoos. There is really no regular zoo practice that you can work at if it's not at a zoo. Very rare. So, those are all the animal practices that I can think of. And we can also talk about what the hospital consists of and what your roles are as an assistant. So, if you work in a hospital, you will be making up the vaccines, you will be restraining, you will be assisting and prepping during surgery depending on how much experience you have. You will be performing laboratory procedures such as blood draws, urinalysis, capillary tests, which come in little hematocrit tubes, and then you have to do, usually you perform blood chemistries, all that kind of stuff, which is usually electrolytes, or you send out and stuff. Sometimes you assist with biopsies and other kinds of surgeries. And you also have to do stock. Stock is an integral part of how an animal hospital works. So you usually have to get all the IV materials, all the surgical materials, all of the examination materials. You have to clean the exam rooms. You have to clean the cages, depending if you're a kennel assistant or not. Kennel assistants and vet assistants, some kennel assistants don't do what vet assistants do, and vet assistants just do the technical work with the technicians. So usually you have to assemble all of that. You have to get prepped up, ready for any procedures that the technician needs to get done with the veterinarian. So you might have to get all the supplies ready for a cystocentesis, a dental. You also might have to prep the food. You might have to, you have to take the dogs outside. You have to chart. Sometimes you have to go in and take a full medical history. You have to do the vital signs. You have to take the temperature. You have to take the pulse. You have to take the respiration rate. You have to take their capillary refill time, which can range, because if it's a bad capillary refill time, it can signify that the animal is in shock, which is not good. You might have to get them instruments for an intubation before they do surgery or before they do a dental. It honestly just depends. Oh, you usually wrap surgical packs. You clean surgical instruments. I mean, usually having an assistant and a technician is very vital to the practice, because an assistant does more of the cleaning and more of the maintenance around the hospital than a technician, depending on where you work. So, if you work in any of those settings, that's mostly what you'll do. You do get to do a bunch of patient care, but usually you have to be there for a little bit to be able to do those kind of duties. If they train you right away, that's great. You also are a very important client educator to the client. So, say that the client wants to know about different heartworm preventatives and different flea and tick preventatives. You, as a veterinary assistant, unless there is a technician in the room and discussing it with them, need to understand what kinds of flea and tick preventatives there are, what kind of heartworm preventatives there are, if they're asking you what veterinary care their kitten needs, what their puppy needs, what any animal needs. Mostly what a kitten needs is vaccinations, which consist of distemper. I'm using a lot of veterinary terminology in this video. I apologize. Distemper. Calcivirus. Peritonitis. Peritonitis. Feline leukemia, feline immunodeficiency virus. Oh, it's DHLPP is what the vaccination usually consists of. And it, depending, I don't have a vaccine schedule in front of me, but when you usually tell them when they're due for their next vaccinations, the hospital usually notifies them. I'm guessing within a month in advance. I could be wrong. When their next vaccinations are due, or that ask if you want to update them today, and if the owner declines, then they decline. You are also in charge of sometimes making up estimates. So that consists of going on a computer, going into whatever veterinary software you have, and putting in all different kinds of codes for different procedures that the animal that the veterinary requested that the animal gets, or any food that the veterinary prescribes, any medications the veterinary wants the animal to be on. Just ranges. I know this is a lot. And then I don't know. That's a lot of the stuff that I know about. I know there's more. I know some practices that an assistant can help microchip an animal. Could be wrong. I don't know where, but I am currently, I'm taking a continuing education course on it. So there is a lot of things they're in charge of doing, like setting up IVs. You can do that. Mostly the animal practice wants you to be there for a while before you start IVs, before you get to draw blood, all that kind of stuff, because they just want to see that you know how to do it and that they like you enough for you to do it. Maybe I shouldn't have put that in there. Anyways, thanks for coming back to my channel, and I will see you as soon as I can. Bye.